using condoms, because if it's not on, it's not
on
safe.
air, online, and even on billboards. The buffet of options for HIV/AIDS prevention and care messages in urban areas. Uganda won international admiration for scaling down infection in the 1990s due to a robust awareness campaign. But there are fears this progress may be erased by risk factors in urban areas, including population density, risky lifestyles, especially by commercial sex workers, long-distance truck drivers and border riders. This has increased infection rates in urban areas to more than 8% compared to 7.0% for rural areas.
Again, the same message, consistent message, the same consistent message of ABC. So consistency is actually the key, irrespective of the population groups you're actually dealing with.
About 300 Ugandans are infected daily and 1.6 million live with the virus. It's against this background that the UNAIDS country director now wants local leaders to be at the fore of the fight against HIV.
Report in the next meeting that this is what I have personally done. We cannot depend to have money from outside. Let's add a little bit of resources so that we can do some of this simplistic, activity.
He was speaking at a meeting of mayors under the Alliance of Mayors Initiative for Community Action on AIDS at a local level, AMICAL, that is looking at scaling up advocacy campaigns against HIV.
When we have a sick population, then we cannot survive as local governments where we rely on taxes. And so it's important that we alert our communities to access services from the various public health centers and, of course, other players in HIV/AIDS.
Also of concern in urban areas is the increase in the infection rate among female university students.
So parents, if you send your children to university, know that there is a threefold increase for your girls to get HIV.
The average cost of antiretroviral drugs is 40,000 shillings per month, translating to about 600 billion shillings a year for the 1.3 million people living with HIV.
The task that all of us have is to keep the 1.6 alive and healthy, but also to keep the 33 or so million people in Uganda free from HIV.
As the local leaders seek a new strategy, there's no doubt that the fight will be longer than the anticipated time frame of 2015. Moses Sakena, NTV.